overlook. And so all of us here at Lighthouse always brace for impact in April because we know we brace for impact in April, and then we brace for impact again when the fall spores start coming and everything that happens, sometime usually around October, November, depending on where you're located. Because we know that everyone's going to need extra support and everyone's going to need a little bit of help with the histamine provocation that's happening environmentally. So by request, actually, and a steady yes, we want this. I'm going to talk about histamine today. We're not a super huge class, so I'm happy to do this kind of conversationally as we go along. So if you've got a thought or a question, take turns, please. But feel free to speak up and be like, oh, hey, what did you mean by that? Oh, can we revisit that again? One of the things that I don't have a great graphic for yet, that I am going to be developing a graphic for, and maybe deserves a little bit of conversation right now, before we get into the graphics, is why are our pandas kiddos sensitive to histamine? Why does it make, histamine might make me sneezy or itchy or my eyes red or might be a little bit irritable, but why does it set off flares or exacerbations? I would be lying to you if I told you.
Stones.
What? Huh? Oh, that might have been an accident. I would be lying to you if I told you that we have a definitive answer to that question, because we don't have a definitive answer, but we do have, at least, of course, maybe it's just a pretty reasonable hypothesis to me. But I just wanted to share with you before we're going to talk about what histamine does, what we can do about histamine, why it works and does certain things, in just a second with some graphics. But I just wanted to talk a little bit about why I think, and this is particularly important for our pandas. Everybody knows, or most people know, unless you're really, really new to this world, that kind of the in the informal trial of whether or not your kiddo has pandas on the internet or in the parent groups is what do we give our pandas kiddos to see if it makes them better if we think they might have pandas?
Ibuprofen
and
antibiotics.
Well, antibiotics, if you have a provider, this is usually before you have a provider. It's ibuprofen and Benadryl. And so when you first think, oh, my kiddo might have pandas, everyone will tell you, oh, we'll try ibuprofen and Benadryl and see if it makes them better. And usually it does make the people marginally better. I mean, it may not make them 100% better, and it's certainly not going to pull them out of a severe exacerbation. But a lot of times, kind of the first clue that you might have is this kind of, unofficial, hey, does this help my kiddo? And you give them ibuprofen and Benadryl, and all of a sudden they have less tics, or they have less urinary frequency, or their OCD calms down, and you're like, oh, I did notice something. Jesse, it's for both. I just tend to kind of talk in kiddos sometimes, because a lot of people here are for kiddos, but this applies to adults too, so I can change my vernacular to make sure as well. So this does also happen for adults, and everything that I say about histamine applies. No, you're fine. Definitely. Sorry, I kind of slip into mom mode, but this definitely applies to adults as well. Adults have the same kind of histamine receptors, and our adults. Now, I will tell you, I do think that pandas kiddos are probably more histamine reactive than, say, our anti-NMDRs or our Caspr-2 encephalopathies. And I'm going to tell you why I think so in just a second. But that still doesn't mean anything that's inflammatory, and histamine causes inflammatory loops, is not going to be good for anybody with any kind of autoimmune condition, particularly one that affects the nervous system. Because histamine in particular is, it's hard on the nervous system, and it causes inflammatory loops and also causes anxiety, which is why, we have hydroxyzine, which is good old Atarax, which is an anxiety medication, but it's also actually a antihistamine. And so, yes, adults too. Thanks for asking that question. So anyway, a lot of times you might hear that, kind of running around online, take that, try it. So why does that in particular happen to pandas, kiddos, and sometimes other immune-mediated encephalopathies? This is what I think and what I see causally. Immune system dysregulation is usually a combination of three things. It's usually a genetic predisposition. So there's some part of the immune system that doesn't actually recognize pathogens well or in the usual manner. And that doesn't always mean straight immune deficiency. Sometimes it does. Sometimes it means less effective ability to fight these pathogens off. Other times it means that the fight gets prolonged and it keeps going and going and going when it should have stopped, when it should have been suppressed. And so some of that is genetic vulnerability, that you have a little bit less specific receptors, or you have a little bit more twitchy immune cells genetically. And then the piece that, I think maybe might get missed a little bit is the folate piece, the B vitamin piece. And if you've been with our clinic very long, we kind of pay a lot of attention to this, because a lot of patients in our clinic, both adults and kiddos, have problems in their folate processing pathways. And what that does is, when you have problems with folate processing, it decreases your mitochondrial function, which is the amount of energy, that your body can make. And not making the proper amounts of energy in your body dysregulates your immune system. Number one energy user in your body is your brain and your nervous system. Number two energy user in your body is your immune system, neuroimmune problems. If you don't have enough energy in your body, your nervous system will dysregulate and your immune system will dysregulate. And guys, if we lose power right now, it's because there's kind of a big old storm passing over me. So I apologize in advance if the power goes off. Hopefully it won't, but I'm just warning you. If it knocks out, I'll do a reschedule at some point. So if you have a lack of mitochondrial function in your body, problems with folate processing that lead to a lack of energy, that dysregulates your immune system, and that makes it where there's not enough energy to both fight stuff off and have an anti-inflammatory effect, or turn off that inflammatory response. And I'll show you a picture in a second, but anytime there is a pathogen or a healing response, we have to have the right amount of signaling to fight, and then we have to have the right amount of signaling to turn that off. And when our immune system doesn't have enough energy, it may spend all of its energy saying fight, 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 and then that has a lot of inflammatory loops that happen and it doesn't get turned off. Or it may spend all of its energy saying suppress, 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 and then you get chronic pathogens like Lyme or EBV or other kind of things that then can kind of take up house in the body, because the suppressive part of the immune system is turned on, but the fighting part doesn't work very well. And in our pandas patients, we see both of those things happening. And then the third thing I think that happens with pandas patients and the inflammatory response is that we have problems with detoxification. So anytime there is a signal in our body saying something, like say we send a signal that says inflame, I need my liver and my kidneys and my other detox processes, the enzymes in my body, to be able to break down that inflammatory signal and send it on its way. So I need my immune system to send out anti-inflammatory signals to stop the attack. And then I need my my detox system to break down the signaling chemicals that are saying inflame, and send them out through my kidneys and my liver. And so it's almost like a perfect storm for our pandas kiddos. They have, a genetic predisposition to not their immune system dysregulating. They have folate processing issues, which affect the energy in their body that dysregulates their immune system. And then they usually have issues with detoxification or getting rid of inflammatory signals. And that puts their immune system kind of on a hairpin trigger. And histamine is great at pulling that trigger. Histamine is great at flipping things into the inflammatory response. and histamine irritates the vagus nerve, and the vagus nerve is the thing that takes you out of fight and flight into rest and digest. And so even the abnormal pupil dilation that you might see in your kiddos sometimes, that's vagus nerve controlled. If I've got histamine irritating my vagus nerve and vagus nerve can't get me out of fight or flight into rest and digest, that affects my autonomic nervous system, which is all of those involuntary things like blood pressure, heart rate, pupil dilation, digestion, all that kind of stuff. And then, then that keeps me in the inflammatory loop. The vagus nerve is also an important signaling pathway for your immune system. A lot of the way your immune system talks to your brain runs up and down the vagus nerve through signaling chemicals. And so if my vagus nerve is hair twitchy over and it won't, hit me into rest and digest very well, there's a lot of inflammatory signaling going on as a result of that process. And so it becomes kind of a perfect storm for our pandas kiddos. We don't have enough. And then there's the detox piece. A lot of times there's problems getting rid of histamine. There's problems with the DAO enzyme or the HNMT enzyme that's supposed to get rid of histamine that's in the body. So I've got this twitchy immune system that's prone to inflammation, can't really fight some stuff off very well, fights other stuff off a little bit too well. And then it doesn't really, get rid of inflammatory chemicals very well, like histamine. And so all of that kind of makes it a perfect storm. It also, some of that genetic predisposition, again, in any autoimmunity is recognizing what is other and what is self, right? If I don't want to attack my own body cells, I only want to attack pathogens. And that's part of that genetic predisposition. And when I think myself should be attacked, then that inflammatory response to fight stuff off happens. And that causes a lot of histamine release because that happens naturally in our inflammatory response. And so that makes our kiddos really, really prone and twitchy to histamine. And then just before we hop into this too, the other thing I want to address is there's been a lot of literature out there kind of saying, oh my God, histamine use is correlated. Antihistamine use is correlated with Alzheimer's. If you take a bunch of antihistamines, you're depleting your brain and you're going to have Alzheimer's. But if you really look at a lot of those studies, it's almost like correlation causation kind of thing. Did the antihistamine cause the Alzheimer's, or do people with Alzheimer's have a bunch of immune dysregulation and they take a bunch of antihistamines because of their immune dysregulation? And the more stuff that comes out, it's really the latter that seems to be true. But antihistamines do deplete choline. And so that's why in our clinic, if you're on an antihistamine, a lot of times we're definitely going to have you supplementing your choline to replace that choline that antihistamines deplete, and that will help protect your brain. And it also helps protect your mitofunction because choline supports mitochondrial function, and we don't want to stress mitochondrial function for our kiddos or our adults who already have mito issues, and anybody with autoimmunity is going to lean that way. So I know that was kind of a long-winded why this happens to us thing. Are there questions about that part of it before I start showing you diagrams?
Yeah. I have a question. Yeah. You talked a lot about the vagus nerve and how it's affected. I guess it's maybe a related question. There are a lot of people, a lot of places online that sell vagus nerve stimulators. Is that something that would be beneficial for this population or would not be beneficial? Because they're kind of having a problem with, it getting up and down the vagus nerve. If we're stimulating it, are we kind of overamping it, or is that like kind of helping it along? Is it like clearing the way?
That's a great question. So the vagus nerve, it can be anti-inflammatory or pro-inflammatory. It can, but its primary function, its main function is to switch you into rest and digest into the anti-inflammatory pathway. So the vagus nerve stimulators can be used to help augment that response. Now, there's a lot of crap out there that's expensive and doesn't work and doesn't have good efficacy behind it. So can you just go buy any vagus nerve stimulator? You can't, especially because a lot of them are super, they're just super expensive and they're not even selling you anything that's really going to help you. Now, there are some though that are properly programmed, and there's some nuances to that, and it can be helpful. I like to tell the story of my daughter. My daughter is autoimmune encephalitis, Casper 2 autoimmune encephalitis, not Pans Pandas. My other two kiddos are Pans Pandas. But my daughter, who has Casper 2 autoimmune encephalitis, Casper 2 attacks your autonomic nervous system. And so she has a whole lot of dysautonomia and POTS and anxiety. And she's she also has a compounded Dow deficiency. So she has a lot of histamine processing issues. And before we were actually able to get her adequate treatment with IVIG and rituximab, she we were struggling. She had lots of different things going on, and we ended up actually in a children's hospital in Colorado with an anesthesiologist that did e-stem acupuncture for vagal nerve reset. And that's where you take acupuncture needles and you hook them up to electrical current, and then there's certain points where you can actually stimulate the vagus nerve to throw you in. We did that, and for the first time in like 3 or 4 years since her onset, she had 5 days where she looked neurotypical completely. Like she looked like she had zero autoimmune encephalitis, and she was pretty debilitated at this time because she wasn't adequately treated. So she had a lot of symptoms, and when we did this e-stem, we thought, oh my God, this is fabulous. It lasted for 5 days. So we went back to do it again. And the second time we did it, it lasted for 3 days. And then you can imagine where the story goes. We went back, we did it again. It lasted for 2 days. We went back, we did it again, lasted for one day. And then we went back and we did it again. And then it didn't work. And we even tried it again because we really wanted it to work, and it didn't work anymore. And so you can get habituated to those kinds of things. They tell you that you're kind of like, we knew then that we were on the right path looking at the vagus nerve stuff, because if it can bring her all the way back out to typical function, then there was definitely something going on there, but we weren't able to sustain it with that. There are also instructions out there to modify TENS machines. I don't know if you've heard of this or not, Brenna, but there are some points and you can modify a TENS machine. There are specific frequencies that you have to use. And some people do find that helpful, especially people, again, with a lot of dysautonomia. And so, long story short, yes, it can be helpful, but it can be tricky to sustain. It can be tricky to know which ones work and which ones don't. And it's not really, I mean, there's just a lot of easier things to do, I think, before you get there. There's also something called a stellate ganglion block. I don't know if you've ever heard this, or SGB. But that's where they actually, usually it's an anesthesiologist, and there's two clusters of the stellate ganglion block, one on each side, and that's how the vagus nerve, it's a cluster of nerves that go in, and from where the vagus nerve communicates with your brain. An anesthesiologist can actually go in with a needle and lidocaine and numb those. And when they numb it, they usually do one side, and then a few days later they do the other side, and it will give you an autonomic reset. It will actually reset your vagus nerve pathways. And they are getting amazing results with that in long COVID, and the dysautonomias that come with long COVID. And so other people who have kinds of vagal nerve dysregulation are starting to use the stellate ganglion block. Usually, of course, that's less kiddos, more adults are using that therapy. If you're interested in that, at our Neuroimmune Day on July 18th, we do have Dr. Groisman coming specifically to talk about that procedure, because he does it all day long at his clinic, specifically for vagal nerve reset. So that's something also that's pretty interesting as well. I'm always really fascinated about the adjunct ways that we can, I mean, histamine is one thing that's going to bother the vagus nerve. There's other things that bother the vagus nerve, which are not our topics today. But there's definitely lots of different avenues through which we can attack the same problem. In Arkansas, we say there's more than one way to skin a cat. And so that's what I always like to tell people. If we can't find one way that works, we can always look at another way that works. There's lots of different ways to do the same kind of stuff.
I may or may not be guilty of altering the TENS unit, and I tried that, and I don't know whether it helped or not. I
Well, you
don't know
have to
that.
kind of do it pretty consistently, I think. It's not like a one and done kind of thing. I think the minimum amount of time you're supposed to do it is like 2 weeks, continue regularly at certain intervals to see. I have all the information saved somewhere if you're interested, but I'm sure if you've done it, you found it. So, any other questions about that kind of general why pandas kiddos are like this?
Tara, this is Skylar. I was just curious, with my son, his allergies, I mean, he has some like, the outside allergies, but his are mainly around histamine responses to food. Have you seen? Okay. The nod,
Absolutely.
yes.
Yeah,
Okay.
yeah. I mean, it doesn't, the triggers can vary. Sometimes histamine response to food happens, which is actually really super common. And one of the best ways to control histamine levels, if you have to go into kind of a total control mode, is to control not only the foods they're allergic to, because sometimes it's foods they're allergic to, other times it's foods with high histamine content. Any protein, when it breaks down into histamine. And some proteins accumulate histamine more quickly than others. So canned food is very high in histamine, and then particularly, canned meats or proteins. And then seafood has a really high histamine content. And so things like
Ah,
tuna fish are very, very high histamine. So you can have a kiddo who's allergic to tuna fish, and that raises the histamine in their body, or you can have a person who is reacting to the histamine content of the tuna fish itself. They're not allergic to tuna fish. They actually are consuming more histamine than their body can actually detox. And so, and I'm going to talk a
interesting.
little bit about that detox capacity. But yes, histamine
Okay.
and foods can be a huge, huge issue. It can be a huge, huge trigger. It really doesn't matter, like I said, whether it's you're reacting to pollen in a tree. Some people who have mold exposure, and particular kinds of mold, that will also really trigger a really bad histamine response. I had a really bad flooding problem in the house we lived in a couple of years ago, and I'm not usually super histamine, but when I had that flooding problem and then we had a mold problem in our basement, we ended up having to evacuate and remediate and do all this kind of stuff. But I was breaking out hives. And that was probably a combined, your body doesn't like mold very much, and your mold's triggering that histamine response, kind of thing. And then my kiddos who are histamine sensitive were way out of whack, so it can be environmental, it can be something that you're eating, and it can also be an allergic response. All of those things were going to generate extra histamine. Good question.
Great. Thank you.
Any other questions right now? All right. So let's start talking some nuts and bolts here. And again, feel free to tell me to stop or slow down or just listen and we'll take questions later, whatever you want. But if I can get a heads thumbs up, when you can see my screen, then hopefully I can, thank you very much, start to kind of talk a little bit about these are histamine kind of, maybe a little bit more than histamine basics, but close to histamine basics. So you have actually 4 different kinds of histamine receptors in your body, and we can effectively really only block 2 of them. So antihistamines, regardless of what we do, they're still probably going to hit histamine receptor 3 and 4 because we don't have great ways to block those. But you can see that histamine affects so many things in your body. Everything from your uterus if you're female, to your respiratory tract, all the way through to your central nervous system. And a lot of people don't really understand the widespread effects of histamine throughout the body. So histamine affects everything from your gastric acid secretion, which we kind of know if you know Pepcid as an H2 blocker, then you know that there is some histamine component there. And so it's not just your mucus secretion or your runny nose or your sneeziness or your itchiness. It's a whole lot, even your heart rate, your vasodilation, all of that is affected by histamine. And of course, a lot of our histamine lives in our mast cells. And then our mast cells do what's called degranulation. And then that histamine comes and hits, the different parts in our body. And this is just this is words, this is pictures to show it affects your brain, it affects your blood vessels, it affects your stomach, your digestion, your heart, all of the different areas in your body that histamine, your neurons. And we can't have no histamine. We need a certain amount of histamine or we're going to fall asleep all the time. It's an excitatory neurotransmitter. So histamine, we have to have enough histamine to keep us awake. That's why antihistamines make us drowsy, because if you get rid of the histamine, then you're going to fall asleep. So histamine, again, is also a balance. It's not just completely a bad thing. The problem is in our population, we just usually have too much of it. Now, this is something that I think is really super interesting. Histamine overload causes an increase in pain. Okay. It's an increase in pain perception, but pain perception and pain are really the same thing. Pain is a signal from your nerves to your brain that it hurts, that something's the matter. And so this is a nice little study from, 20 years ago, 26 years ago now. Oh my God. That when they knocked out, certain histamine receptors in mice, then all of a sudden you could burn the mice's tail or flick their ears or, poke their paws or whatever, and they didn't react because their pain response was blunted because there was no histamine amplification. And that's super relevant to our PANS kiddos, our PANS pandas kiddos specifically, not necessarily, or people, but not necessarily other kinds of autoimmune encephalitis, because we do have pain amplification in PANS pandas. And this is something from Stanford, well back from 2019, about 7 years ago, showing that, well, in the cohort that they looked at, 48% of kiddos with PANS pandas had pain amplification syndrome. And that means when you barely touch them and they're like, oh, that hurt, it really hurts. Okay. Now, it's not damaging their tissue or dislocating their shoulder like they're acting like, but they really feel it that acutely. And so when anybody with a disordered immune system tells you something hurts, you have to believe them. They're not making it up. They're not pretending. Their nerves are telling their brain that they have pain, something's the matter in that area, and they experience that as pain. The most common in PANS that Stanford found was headaches and abdominal pain, but some people did develop complex regional pain syndrome or widespread body pain. 15% met criteria for fibromyalgia, and it was strongest around PANS onset. And so this is something I think that's more particular to PANS pandas than necessarily other kinds of autoimmune encephalopathy. But PANS pandas does amplify pain a lot. And I think that this also might be part of the histamine, dysregulation in the body, because histamine makes things hurt more. It amplifies the pain syndrome. It would be interesting if they would have pulled histamine levels and IgE levels and stuff on this patient, but I don't think they were thinking about that back then. So there are different kinds of histamine disorders, and a lot of times these can be comorbid to our patients with any kind of immune-mediated encephalopathy, because one kind of immune dysregulation tends to kind of domino with others or come hand in hand. This is particularly true for our POTS, MCAS, Ehlers-Danlos people, who a lot of times often can also have encephalopathy, because they definitely tend to have a lot of histamine issues, maybe even mast cell activation, and problems with collagen. Exposed collagen actually causes a histamine response in their bodies. And so, but there are different kinds of actual histamine disorders that can also go hand in hand. One of those is mast cell activation. So your mast cells are like little containers for histamine. And mast cell activation means that they spit out their histamine faster than they should. They're very, hair triggery, like I said, and they degranulate and they release histamine too often. There's mastocytosis, and that means you have too many mast cells in your body. So your mast cells may be a normal amount of twitchy. They may not release their histamine too often, but you have so many of them that they're continually kind of getting triggered. Mastocytosis is pretty rare. It's verified by skin biopsy. We've only had a couple of patients in our clinic that have had actual mastocytosis. And then there's histamine intolerance, or a lot of times that is your diamine oxidase deficiency. So that is not that your mast cells are twitchy or that you have too many mast cells. That is that your body can't break down and process histamine normally, so it builds up. A lot of times the histamine intolerance or diamine oxidase deficiency is misdiagnosed as mast cell activation. I mean, when you're lowering histamine, whether or not it's mast cell activation or diamine oxidase deficiency. So a lot of the same stuff will work, but mast cell stabilization is super important in mast cell activation syndrome, and probably secondarily important in DAO deficiency. And so I'm really kind of picky about that. I like to really kind of distinguish that. Again, that kind of comes from personal experience. That same daughter that I told you about that has dysautonomia, she had idiopathic anaphylaxis episodes at onset of her autoimmune encephalitis. And so she ended up with like 8 EpiPens in 6 weeks, and we were spending time in the PICU and they couldn't figure it out. And it turns out she actually had a diamine oxidase deficiency that was letting histamine build up in her body to the levels of anaphylaxis, which is pretty rare. But when they were looking through all these food allergies, or they were looking for mast cell activation or mastocytosis, they couldn't find any of those things. They couldn't figure out what it was. And then like I said, then in the end, it ended up being diamine oxidase deficiency. And so I do, because if you have diamine oxidase deficiency, supplementing DAO helps you a whole bunch. If you have mast cell activation syndrome, supplementing DAO will help you some, but not as much as if you have diamine oxidase deficiency. And the same thing, if you have mast cell activation syndrome, you really want to work that mast cell stabilization pathway, which if you have diamine oxidase deficiency, that will help you a little bit, but not as much as taking DAO. And so you're therapeutically where you target and where you put those hard-earned bucks for these like supplemental treatments that are not like covered by insurance always really kind of matters when you're trying to pick out which one of these kind of histamine disorders we're dealing with. We do know the SNPs that are primarily involved in some of these histamine issues. If you have like a Sterling's app or a SNP read, it can be a little bit confusing because there is a different SNP that's actually called DAO. It's the diamino acid. The diamino acid oxidase. This is not your DAO that breaks down histamine. Your DAO that breaks down histamine is your diamine oxidase, and it's coded for by the ABP1. So if you're looking to see if you have the SNPs that predispose you to having a problem with the histamine breakdown, you're not looking for DAO. You're looking for ABP1 that codes for the DAO enzyme, which is not the diamino acid. It is the diamine oxidase. They really like to make stuff confusing for us. Bottom line with that is, just ask your provider if you're interested in knowing if you have a problem with your histamine breakdown. Say, hey, can I get a SNP test so that I can see about my histamine breakdown, and your provider can help you with that. So the diamine oxidase is the primary enzyme, and the HNMT is the secondary enzyme. We can also run labs. We can run serum histamine levels, which show up in some people, and some people they don't. The gold standard is a 24-hour urine histamine collection, which is kind of a pain in the butt because you get to carry around a jug of urine all day. We don't do that as often, but sometimes if people wanted us to, we could. There's IgE levels. There is a tryptase level. Now, we are getting some tryptase hits. It's less common than maybe a serum histamine elevation or an IgE elevation. But really, when you're looking at mast cell activation syndrome, you want to get a tryptase within 6 hours of an acute event. And that's kind of limiting, So you want to get, itchy hives, whatever it is the symptoms are, and you want to get in the lab within 6 hours. And so for some people, that's harder than others to do. Most common things we are seeing with histamine are hives, eczema, itchy eyes, runny nose, postnasal drip. But we're also seeing stomach aches, constipation or loose stools that dysregulates your bowels. Brain fog can really be caused by histamine. And for females who have cycles, your histamine reactivity can also vary around your cycle. And that is because your diamine oxidase enzyme also processes estrogen. So at certain points in your cycle, when estrogen is higher, you have less capacity in your diamine oxidase enzyme to break histamine down, and that can cause you some histamine symptoms. And here's a little, a little pathway kind of diagram that shows that. So histamine gets broken down by the DAO enzyme, and then it also gets broken down to the HNMT. into its other metabolites, and then those either get reused or they get detoxed out through your kidneys usually. Histamine, I think, is more kidneys than liver. So that's the two major enzymes for the clearance pathways. And if you have, SNPs or alleles that make those pathways not work as well, you're naturally going to build up more histamine than other people. And then if you've got a twitchy immune system already that in an inflammatory pathway attacks your brain for some reason, having excess histamine around is not going to be your friend. It's going to make pain and things hurt more, and it's going to make your immune system kind of stay in that inflammatory loop. There are certain nutritional deficiencies also involved in histamine breakdown. B vitamins are very important. They're required for the HNT activity, and then copper and vitamin C are crucial components of the DAO enzyme. So when you have an enzyme, works to build things or to break things. We call them builders and busters. And these are the enzymes that are busters up of the histamine molecules. But those enzymes, they need two things usually to work. One of them is ATP. They have to have mitofunction to be able to power the enzymes to bust stuff apart. And the other thing is they have kind of certain keys, and those are cofactors. And if those keys are not in, when you put the power in, it doesn't work. It won't bust the things apart. And so you can see that our pandas kiddos have kind of a double deficiency there. They don't have as much ATP to power their enzymes, and then a lot of times they can be deficient in these B vitamins that are or copper, B6 and C that are required to make these buster enzymes get rid of histamine in their bodies. There are histamine degrading bacteria, and you're going to notice that a lot of times when we ask you to take a probiotic, there's going to be bifido in it. And that's just one of the other things that bifido does that helps. And you can also use the Lactobacillus rhamnosus, which will reduce that mast cell activation. And so there are a couple of companies that make specific probiotics that are targeted for histamine degradation. Some probiotics actually can increase histamine as they ferment things, because again, as proteins break down, they're going to release histamines. And so picking your probiotics, some people can be sensitive to them if they're very histamine sensitive, and these are kind of strains that you want to look for to help versus hinder the histamine load. And this, I think, is a really great way to understand histamine. So when we say be gluten-free, we mean be 100% gluten-free. When we say don't eat dairy, we mean don't eat dairy at all. When we say, oh, you might want to, avoid histamine in your diet, we don't mean that you have to avoid all histamine. In fact, that would be impossible. We mean that you have a histamine bucket, and your histamine bucket, as long as you keep it below the overflow level, you're okay. You're supposed to have enough histamine in your bucket to keep you awake. You're supposed to have a certain amount of histamine there. But if you have a lot of mast cell degranulation or your DAO enzyme that helps your overflow and helps your histamine get recycled, if your DAO enzyme's clogged up, or you got a torrential rain of histamine from your mast cells, then your bucket can overflow, and then you're going to feel really bad, whether it's acute anaphylaxis, or you're going to get diarrhea or eczema, or whatever it is that's going to happen to you. And so thinking of histamine as a bucket, that it can have some, but it needs to not overflow. We used to have to do diligent histamine diet management for my kiddo that was doing the idiopathic anaphylaxis stuff before we figured out the diamine oxidase deficiency. And even today, she will watch her histamine. She watches her histamine around cycles. She can tell when she feels like her histamine levels are getting too high. So she's not going to choose to eat leftovers from 5 days ago and tuna fish and a really ripe avocado all in the same day, because that's going to throw her histamine way high. But she might be able to eat just the tuna fish sandwich in a day and be just fine, because that didn't overflow her bucket. And so when you're thinking about things like that are high in histamine, like seafoods or canned foods, leftovers, all of fermented foods, sauerkraut, kimchi, all of those kind of things that are very high in histamine, you want to kind of pick and choose and make sure that you're not like overloading with histamine. Lunch meats are very high in histamine too. Sausages, those kind of things that have been sitting there cured, but there's still high histamine content in them. Those will fill up your bucket a lot faster than fresh foods and other things. And then there's some things that make your mast cells more twitchy. If you've already got twitchy mast cells, then then there's some things that can make those activations happen. One of the big things is your allergens. So if you're having IgE reactions to stuff, of course, that's going to release histamine to granulate your mast cells. Sulfites can do it. Certain berries can do it. Certain vitamins can do it. I don't know if you've ever had a niacin flush, but oh my God, I thought I was going to die the first time it happened to me. But it will liberate histamine from your mast cells. I was actually going to a doctor's appointment and I didn't think about it. And I was going to try some niacin and I just popped like, I don't know, it was like 200 or 300 milligrams of niacin in my mouth at one time. And I walked out of the elevator to where this appointment I was going to, and I was like beet red. I was hot. I didn't know what was happening to me. It was, 20 years ago. So I was only like 30. It's like, it can't be menopause. It's like, and it was the niacin. And how do you stop that? You take an antihistamine. And so that was really really enlightening for me. I've experienced that personally.
Yeah.
But I thought this is a good way to kind of illustrate, to think about that. You have a lot of choices when you're talking about mast cell stabilizers or histamine releasers. This is actually something from IFM that kind of lists some of them. There's cromolyn, there's quercetin, there's all of these other, you'll notice like we like Lutamax in our clinic, which is luteolin and rutin, both here on the mast cell stabilizer list. A lot of people do like curcumin. PEA is a big one that we use a lot of as well. PEA actually stops pain transmission signals as well as acts as an antihistamine and a mast cell stabilizer. So it blocks the receptors, stabilizes the mast cells, and also blocks pain transmission, which is really convenient, which is why a lot of our people all across the board do really, really well on PEA. Because it helps with that inflammatory response. But we've got these are a lot of natural choices. Of course, we also have prescription and over-the-counter choices. Basically, the way our providers kind of keep a running tally, and for some people, it's actually a written tally in your chart. We want people who have histamine issues, and this is most of our PANS PANDAS kiddos, to be on a short-acting H1 blocker. And this one might come and go. You may not have to always be on it, but definitely in April when the pollen's like, pollen up on your car, you would like to be on this short acting H1 blocker, whether it's Benadryl or hydroxyzine or chlorpromine malate. Those are the big ones, the most common ones that we have people on. And then we often layer these with an long acting H1 blocker. And these are the ones that people do kind of stay on. So Zyrtec, Xyzal, Claritin, Allegra, all of those that are over the counter. These are long-acting H1 blockers, and they can be layered with the short-acting H1 blockers to give you better coverage. And then H2 blockers, Pepcid or Tagmet. Now, you don't want to stay on Pepcid or Tagmet, forever and ever, because then you're actually going to really decrease your stomach acid, which is going to allow pathogens to get in your gut, which is going to, decrease your absorption and your digestion and your mitofunction, and it's going to be a thing. But going on these H2 blockers for short stints, so when I say short stints, I mean like 30 or 60 days during allergy season is perfectly okay to kind of get the histamine under control. And then we have mast cell stabilizers, we have Ketotifen, we have Lutamax, we have PEA, we have a lot of all these things on this list up here. We kind of shy away from Singulair. Singulair can work for some people, but Singulair has a very high neuropsychiatric profile. And if you have autoimmune encephalitis or you have PANS PANDAS and you're already struggling with the psychiatric profile, we don't want to add another medication that might help your mast cells, but might also make you rabidly angry or make you hallucinate. And then it might be hard for us to tell, was that the Singulair or was that your autoimmune encephalitis that was getting kicked up? And so we tend to kind of shy away from Singulair in our population for the most part. Now, sometimes we do get people who come into our clinic and they've been on it for years and they feel fine on it, and that's okay. But and sometimes we have people who go to a different immunologist while they're seeing us, and then they come in and they're, they have a 10-year-old that's busting down the doors trying to beat up his mom or something because he tried Singulair. So we tend to kind of shy away from that one. Then there's the diamine oxidase. We are lucky that enzyme that lives in your stomach that breaks histamine down can actually be orally supplemented. It's over the counter. Histamine blocker is one of the names. There's lots of different kinds. You can get them on Amazon. If you take the DAO enzyme, especially at meals, that helps break down any histamine that's coming into your food, as well as any excess histamine that works in your stomach. You'll notice if you're on IVIG, then this is part of our reaction prevention protocol. We have all of these pieces, but you can do that same reaction prevention protocol to prevent allergic reactions when it's histamine season, by, following this kind of pattern of H1, H2, mast cell stabilizer, DAO. And then the kind of one of the later and greater things that we've, discovered to use in our clinic is All Clear. And All Clear is actually made from quail egg. Who knew? Because quail egg has a trypsin inhibitor that, basically stabilizes mast cells in it. And I'm telling you guys, this stuff works really, really well. This All Clear, which you can get through your Full Script account with us, or you can find it on Amazon. It is an acute kind of thing. So if you start to feel itchy, and these are chewables, and you chew a couple All Clear, at least for a certain percentage of our population, it provides relief in 10 to 15 minutes. It's like fast working. And we are really loving this at our house as a way, especially during allergy season, if you start to feel like, okay, that, that histamine creep, having the All Clear is a really good thing. So you can talk to your provider. Your providers are, they're watching for these things with all of our patients. They're also watching for side effects. Constipation is a side effect of the short H1 blocker. So you have to make sure that you have a good bowel regimen going on if you're using a lot of these, and adding the choline will help. The choline, the reason why these cause constipation is because choline is needed for that wavy motion of your bowel. Replacing the choline that the antihistamines deplete will also help you not be constipated. But we definitely don't want that, because that stresses your detox system more. If stuff's sitting in your bowel and reabsorbing, then it's not, decreasing your inflammation. But this is a really kind of a recipe for histamine control, if you will. Now, this is the part I was telling you about. So any kind of, injury or healing response, histamine plays a role. And so this is just a typical wound drawing. And so if there's a wound here, and then there's these, little bacteria and pathogens coming in through this wound, there's all sorts of processes happening in the body to try to heal this wound and help close it up. And the first thing that's happening, not necessarily the first thing that's happening is the pathogens coming. The second thing that's happening is there's platelets rushing over to try to stop the bleeding from where the vessels are actually broken. But the third thing that's happening, so pretty early on in the healing response, is that mast cells are releasing histamine. It's part of healing. You need your mast cells to release histamine because that makes your blood vessels permeable. And then those neutrophils, part of your innate immune system, can slide through the walls of your blood vessels and can go in and attack this bacteria and eat it, and also send other signals out called cytokines to other cells in your immune system to come and help fight things off, and also to start to repair those tissues. And those cytokines get in your bloodstream and recruit these other cells. Histamine is what allows this, these neutrophils to come through, and what allows the cytokines to come in. But if you have just a bunch of high levels of histamine sitting around all the time, then you have, too much blood vessel permeability, then that will kind of perpetuate an inflammatory response that you didn't want. And this is all part of the innate immune system. Who can tell me the difference between the innate immune system and the acquired immune system? Can anybody tell me that? Just me, my old geeky self. So your immune system is artificially divided into two parts when we talk about it, because it's easier to study it that way. And one side is the innate, and that's your immediate response to pathogens. This happens almost instantaneously. Your body doesn't wait to see if that bacteria is going to replicate in that wound or not. The minute it senses bacteria, it sends out its invaders. This is like the front core of the army. It's like the nuclear bomb kind of get out of my body kind of stuff here. This is not mediated by any immune memory. Okay. Your body doesn't have to remember a pathogen to do this. It just automatically goes, oh, this is not self. Get out of here. Let's initiate this immune response. Then the other part of your immune system is the acquired part of your immune system. Oh, look, I do have a slide here. So the innate response involves your macrophages, your natural killer cells, your neutrophils, your endothelial cells, and your histamine release is generally a part of this innate side. Then you have your acquired side. Your acquired side is your immune memory. So that's antibodies. Your body has seen this pathogen before, it remembers it, it flags it, and then it sends different kinds of immune cells to attack. That response takes some time. Your innate system gets called up right away and starts pounding on stuff while your body takes time to remember it and sends in more of the bigger dogs, the more organized things. But it takes, 4 or 5 days for your acquired immune system to come in. Your innate immune system is activated, almost immediately, but within like 24 hours. And so there's a difference in that kind of response. One of the key differences, or not necessarily differences, but one of the key distinctions of PANS and PANDAS is an acquired response to strep. PANS is postulated to have this innate involvement, the more acute reactive innate side, as well as maybe some antibody response. Antibody positive autoimmune encephalitis, the other kinds like anti-NMDR, like I said, and MOG and all of those tend to lead more heavily over here on the acquired. The acquired and the innate, they do talk to each other, these immune cells. Obviously, this is an artificial separation, like your immune system is all sending all of these things all the time. So they do actually, work in conjunction. But a big thing for our PANS kiddos is this innate response side. And it's also a lot of times where there's some things are broken. There's some things called your toll-like receptors that get fragments of viruses or fragments of fungi, and they set off this innate response. And some of our kids don't have their toll-like receptors don't work very well. There's other kind of antigen recognition molecules in our body that can not work very well. And the more we study PANS, PANDAS, the more we find out that our kiddos a lot of times, and I'm saying kiddos because they're supposed to be pediatric onset at this point, they have problems recognizing the pathogens and then properly fighting them. And then this innate response gets overactivated. And then oftentimes also the acquired response gets overactivated. And then before you know it, we're not just attacking pathogens, we're attacking ourselves continually, particularly our brains. And then that's where we kind of land. So when we're managing, an antibody-mediated encephalopathy like anti-NMDR, turning our B cells off and stopping those antibody flags might be enough. But a lot of times, if we're dealing with PANS and it is a matter of both sides, you may not get the same response. You have to work both sides of the immune system, both kinds of triggers and pathways to be able to get adequate control. So the inflammatory response involves histamine, chemokines, and leukocyte release molecules that increase the body temperature. But you can see that histamine does play a big role in the inflammatory response. So you don't want an excess of histamine, because then you're just going to keep having your vessel dilation. You're going to keep perpetuating this inflammatory response. You want your histamine to rise when you need it, and then to be broken down and flushed out of your body when you don't need it, so you don't stay in this perpetual innate activation. And like we mentioned earlier, it also irritates the vagus nerve, which can tell your brain that you need more immune activation than you really need if it's not, signaling properly and turning off the inflammatory response and putting you into rest and digest. I just threw this slide in here because I thought it was interesting also just to show, the reason why IVIG can be a really great option is that it does have, it plays both sides of the fence. It not only regulates NK cells and not only antibodies. A lot of us think about it as antibody regulation, B cell modulation, neutralization of autoantibodies. It also inhibits inflammatory cytokines and regulates the NK cells. And that's why we're getting, an 80 to 85% response in PANS PANDAS patients with IVIG, because we're getting both sides, both modulatory sides. It works pretty well for antibody-mediated autoimmune encephalitis, but a lot of times we need to go in and maybe make that jump to rituximab and turn off those antibodies. But sometimes you do that in a PANS patient and you're not hitting both sides, and that doesn't even work. It's not even enough. Or oftentimes IVIG works better than rituximab, like rituximab works better for the AE patient, the straight antibody AE patient, and IVIG works better for the PANS pandas patient, because it's this whole innate piece that we're talking about. And this is where histamine lives. Histamine lives over here on this innate immunity side, a lot. So that's kind of my overview of kind of like why our kiddos struggle with this. It's a little bit of, what this is doing in the body, and then what are the things that we can do to stop it. And now I'm ready to be plied with your questions for about 15 minutes.
I have a question. On that last slide that you had pulled up, how IVIG kind of, helps in all those different areas. I've also been reading a lot about this CAR T therapy that's come out. How maybe that's another topic for a different day, because that might go off in a different direction. But how would that be a similar sort of deal? Would that be completely different? Okay, help me out.
It looks like it might be permanent. I'm so excited about CAR T therapy, guys. I cannot wait until we can access it. I'm so hopeful that it can put our kids into remission and not make us have to continually fight with this. Now, I mean, obviously, we don't have data yet on autoimmune encephalitis, but on July 18th at that conference I mentioned, Dr. Amanda Piquet is coming to keynote for us. She's already doing CAR T therapy in research for stiff person syndrome. And she now has a clinical trial in the works for CAR T therapy for autoimmune encephalitis. And at my house, we are dancing hopeful, happy jigs about CAR T therapy for autoimmune encephalitis. We really, really hope that it's going to be, a lasting reset of the immune system, but it's not necessarily the histamine pathway. It's kind of a different topic. I do encourage you, if you just Google Amanda Piquet, that's Piquet, and CAR T therapy. She just gave a presentation on CAR T therapy that's online on the UC Health website, and you can watch her talk about it. But it's super exciting. I'm super excited about it, and I really hope. I mean, I think we're probably in a 2 to 3 year wait before we can actually get it. But the minute we can figure out how to do it, we are definitely going to be doing it, because it's really, really hopeful for our population.
That's really cool.
Thank you, Whitney.
Kara, I have a quick question, and this is probably a dumb question, but so after IVIG, when you're doing kind of those after days and you're doing the DAO and the H1 and all of that, I'm assuming that's because typically you prompt a high histamine response to IVIG. Am I right on that?
Yeah, so there's 2 reasons for that, Skylar. First of all, IVIG, because it's a protein, immunoglobulins are protein, that bottle contains histamine. So with the cure, we're also putting a little bit of the poison into the veins. We are directly infusing immunoglobulins and histamine into the veins. And then there's the inflammatory response. Anytime there's a healing inflammatory response, we're going to release histamine. And so that's why that week after IVIG, a lot of times symptoms can kind of get worse before they get better. And a large part of that is the histamine response. So yes, we're trying to control histamine with our RPPs for the most part. Right.
So it's so funny how timely this is, because Riker's now, I think, 9 days post IVIG, and that first week was a little rough, like you're right. And then yesterday he's like, Mom, I'm craving fish. And I didn't even think about it. And we made him fish for lunch. And then he had this terrible headache. And I'm like, crap. It must have been like, as we're sitting here, I'm like, it was the histamine response.
Histamine content. Yep. Fish and seafood are very, very high histamine content.
Yeah.
So save your fish for like the few days before you get your next IVIG.
Yeah. Thank you.
Okay, Vivian, did you have a question?
Yes. Just the logistics thing. Can we access these slides and this information?
Yeah, I can send them to you if you just shoot me a message in the portal, and I'll send them. I'll have someone get them to you by email.
Okay, yeah, I was like specifically wanted to write down that info on the probiotics, just because I'm not being very particular about what we're buying, and it might be worth looking at what we're utilizing for both my son and myself. Okay, and then also just logistics. So if this was more of like a deep dive session, when is the intro session? Do they alternate month by month, or is it more just on your schedule, like, less?
So we just redid it. Brent, I hope you got, well, actually, I don't think we've sent out the message yet. So these sessions are moving to Tuesdays. And the first Tuesday of the month is IVIG. The second Tuesday of the month is going to be Intro to Pans Pandas. The third Tuesday of the month will be a deep dive and the topics will rotate. So we're talking about histamine this week. We might talk about the sinuses next week. And then we might talk about IEPs in school the week after that or whatever it is. That'll be the third one.
Okay.
And then the fourth Tuesday is a new patient orientation, which you guys don't need.
Do you think, or is it your experience that if a kid has a PANS panda diagnosis, like he innately has a problem with histamine, with histamines then?
Usually they do. It would be rare for them not to have some kind of allergic sensitivity and have PANS pandas. I'm not saying it's impossible, but it would be rare.
Mm-hmm. I just feel like we have like some indications that he has PANS panda, but then a lot where he doesn't quite fit the mold. And he's on a million supplements from a great provider at Lighthouse, as well as things we've been doing before. So it's like I don't see a ton of symptomology, but it doesn't mean that, I guess, that it's not occurring.
Well, I mean, like I said earlier, stomach aches can be histamine, constipation can
Right.
be histamine,
Yeah.
urinary frequency can be histamine, headaches can be histamine. So they're like,
Mm-hmm.
there's a whole bunch of things that can be histamine that you don't think about traditionally as histamine. But we do have laboratory evidence that we collect to see. We measure, immunoglobulin levels. If your IgE is really elevated, we can check your tryptase, we can check your plasma histamine levels. We can look at these, factors. I would say that, running the lymphocyte panel and the immune labs really, really helps us kind of delineate, which kiddos are more histamine prone and which people are more, other kinds of inflammatory pathway issues. And it
Mm-hmm.
also really helps us. We're constantly trying to suss out, is this PANS pandas? Is this an antibody positive AE? Is this some other kind of issues? I mean, I see a note here for those in the beginning stages of figuring out their diagnosis and treatment plans. Do you recommend allergy testing? And we do, like, especially if we're not sure what's going on, we want to run all of these kinds of different things, and that helps us refine the diagnoses. But your provider is not just going to give you IVIG because they think you might have PANS pandas. They're going to really dig in and decide if you're fit diagnostic criteria and if that's something that you need before they even suggest something like IVIG. And so there's a whole process that goes into figuring out, is this what's appropriate for you or is it not?
Mm-hmm. I guess I was wondering, like, if a person, in this case it would be my kid, but anyone is taking a bunch of supplements and they're actually helping and are efficacious, then would the like histamine be well managed, I guess, is what I'm wondering.
Oh, yeah, absolutely. It certainly can be. Yeah, that's the whole
Yeah.
point, right? The whole point. Now, if you feel like you're taking a whole bunch of supplements and you're not sure why you're taking them all, or you're feeling like you have an huge supplement burden, then please ask for a supplement review. And that you can
Yeah.
even do that through the portal. You can do that. It's actually better to do it at the portal than kind of try to hash through it at a appointment, just because there's more time in between appointments to kind of have the research team go through and look, and have your provider look at your chart and kind of tag things and make a better plan for you than trying to do it in the 30 minutes when you're trying to talk about everything else. But if you're
Mm-hmm.
feeling overly supplement burdeny, just put a message in the portal. Hey, I would like to request a supplement review. We're taking a lot of things. I want to make sure that I've identified the critical ones and the ones, that we're sure are helping versus the ones that might, we might want to drop off.
Okay. Okay. So, sorry, I just wanted to review was the like overview for Pans Panda happening?
It'll be the third, I'm sorry, the second Tuesday of June, because we're
And
already in May.
and that'll be right, but that'll be like monthly. If I
Yeah.
missed that one, it would be the third. You said second Tuesday of July. Yeah. Okay. Awesome. Thanks.
Sure, no problem. And And then I see for those in the beginning stages figuring out their treatment plans, Jill has been tossing around hypermobile EDS, MCAS and POTS, and now possibly autoimmune encephalopathy. I will tell you, we have a certain cohort of patients that has all of that. We have a certain cohort of patients, and that's because the hypermobility, the EDS, causes permeability in the brain-blood barrier, which then predisposes you to autoimmune encephalitis by permeability of the brain-blood barrier. So antibodies come across that wouldn't normally. Of course, the MCAS is inflammatory, and then the POTS is the dysautonomia from the vagal nerve dysregulation, which then affects the immune system. So it's not an uncommon, I guess, the triad is EDS, mast cell, and POTS, but there's actually like a quadra too that would be autoimmune encephalitis, mast cell, POTS, and EDS. And that's not an uncommon combination in our clinic. If you were diagnosed with those things, you would not be the only one. I should probably have a class for that triad or that quadra too. I will also say we do have in the works that quadrilateral seems to happen a lot in our clinic in the young adults, the older teens to maybe mid-30s kind of really come to us for that. And there is murmurings now, and we have a couple of young adults themselves that are talking about organizing a support group for young adults age. I think they're going to do 18 to 30, I think is the what they're looking at right now. So if you have a young adult or you are a young adult that is interested in looking in that kind of support group, dang, I'm 37. Well, and I think that eventually what we hope to have is also adult support groups and then even parent support groups. But we do need, people from the community to kind of maybe jump in and say, hey, I'd be willing to be a facilitator in some of those things. Because like the young adults don't want someone like me coming in and trying to tell them what to do. It needs to be kind of, patient driven from people in their specific demographics, I think. And then of course we will help facilitate getting everybody together, and then we'll also have our providers and our other staff as resources to come in and give topics and presentations by request. But that is in the works, and hopefully eventually we'll have all three of those demographics. We'll have young adults, and then actually we want younger teens too, like teen tween, and then young adults, and then adults, and then parents. We'd like to have all four of those eventually for Lighthouse patients. There's enough of us now. There's enough of Lighthouse patients now that we could definitely fill those groups if we had enough people facilitating. I just can't facilitate all of it. Other questions? Speak now.
Just wanted to say thank you, Kara. You really, these are so informative. They really are.
Good. I'm glad you enjoy them. Thanks for hanging out.
Do you have any suggestions for the all clear? I ordered it after your last talk and gave it a try. Do you have any suggestions of ones that don't have xylitol, because it gave me a headache?
Oh no. I don't know if they make any. That's the only quail egg formulation that I know. What I might try if I were you, I might just try buying some quail eggs, cooking up the egg part of it, and then powdering the shell part of it, and seeing if I could do the powder in a little bit of yogurt or something, and seeing if it helped at all.
So it's specifically in the shell. Okay. I did go and buy quail eggs. My parents live in a very small town area, and their little tiny grocery store had quail eggs, and so we bought quail eggs. But I wasn't sure what part specifically was the important ingredient there.
I think so. Maybe I'm lying to you. Hold on.
I checked the back of the bottle and it said proprietary formulation, so that didn't help me much.
The inhibitors. Oh no, I'm wrong. It happens sometimes. It's not in the shell. It's in the white.
Okay.
Well, that's a lot
So-
easier.
Yeah.
That's a lot easier. Yeah, it is. That's no. Learn something new every day. Look, you taught me something. Yep, it's in the white. It says primarily in the egg white. So
And again, that works as an antihistamine. Am I right on
Yep.
that?
it's a
That
mast
is
cell
so
stabilizer.
cool.
It's a mast cell
Wow.
stabilizer.
All right.
So I wonder, like, if you could make a meringue and just eat some meringue when you needed it.
Any excuse for pie, right?
I was thinking it would take a lot of quail eggs to make a meringue. They're tiny.
They may ask what you're up to if you got all those at the grocery store. That's for sure.
Yeah, but nope. Yep, it says it's in the white. So I will ask. So we actually have an integrative therapeutics guy that's really smart, and he brought me some of the research on it. And I will ask if they have any idea of a formula without xylitol or where to get it. But my suspicion is no, because this was, like I said, it's kind of a new product within the last year or so. So I'm guessing they probably don't have different formulations. They may in the future. They're pretty good about doing, like, they have a curcumin and a low phenol curcumin, and they have like different formulations of some of their other stuff, but I don't know what their plans are for that one.
I made my husband try it out too, and he said it worked for him. But I got a headache. I thought, oh, it's just coincidence. But I'm always sensitive to the artificial sweeteners, so I was like, darn it.
Darn it. Well, maybe